Hello everyone, this is Ola. In this video we will discuss the types of deafness. There are two types, conduction and neural deafness. The conduction deafness happens at the level of the external and middle ear. So it happens in the air conduction. Remember that the external and middle ears are full of air. It can be due to a cause in the external ear, like wax buildup here, obstructing the sound vibration. It can be due to rupture of the tympanic membrane or infection in the middle ear. So anything happens in the external and middle ear affecting your hearing is conduction deafness. On the other hand, the sensory neural deafness happens due to three causes. It's either the reason is in the cochlea, where we have the receptors of hearing, or it can happen in the cochlear branch of the vestibulocochlear nerve, or it can happen in the brain itself due to a stroke, affecting the cortical part responsible for hearing, which is cortical deafness. The Webber's test can detect the conductive deafness. So if somebody comes to the clinic complaining that there is a hearing problem on one ear, suppose this ear here has a problem as the patient complains, then you put a vibrating fork here in the middle of the forehead. The normal response is that the person should feel and hear the vibration equally on both sides. How about if there is really a conductive deafness on this ear, then the vibration will be louder in the affected ear. Why is that? Because here the vibrations go and stimulate the cochlea directly, and it doesn't go the normal pathway from the external, middle, and then internal ear. So it avoids all of this. The other ear is healthy, so the sound will go the normal direction and going this way and stimulating the cochlea at the same time will lead to kind of distortion of the sound. So if you hear the vibration louder in one ear, this ear is likely to have a conductive deafness. Then the Rene test compares bone conduction to air conduction on the same ear. So here you put the vibrating fork behind the ear on the mastoid process. The patient will hear the vibration. Once the patient stops to hear that, you move the fork on the front of the ear. The patient should still hear the vibration. Why? Because bone conduction is less than air conduction. Now, how about if the patient is able to detect the vibration when you put the fork on the mastoid process, and once you get it in the front of the ear, he doesn't hear that? Then this ear is likely to have conductive deafness. So again, the normal response is that bone conduction is less than air conduction. And in case of conductive deafness, the opposite happens.